Good morning, everyone. Myself, Dr. P. Samuel, Assistant Professor of Biotechnology of INR Janaki Ammal College, Sivagasi. Hope you were all noticed my previous video on the pathogenesis of COVID-19. So, another risk factor associated with COVID-19 is an infection caused by Mucor fungi, and the term or the clinical term which we used to mention the clinical manifestation is called Mucormycosis. So the term mycosis refers to the infection caused by fungus. In particular, it is caused by a group of Mucor fungi. It is called as Mucormycosis. So this is what we are going to discuss through this video tutorial. Come on, let's move into the main section. Fine. So what is Mucormycosis? So as the name suggests, right? So it is an infection caused by the fungus called Mucor species, right? Actually, it is a fungal infection, and the prevalence of the infection is rare, right? The infection rate is very rare, but if the infected patients are not handling in a proper way or not treated properly, it leads to critical state. Fine. Another interesting factor is the spore is adequate or ubiquitous in nature, which means the spore is present everywhere, right? It is not restricted to this particular ecosystem or that particular ecosystem, not like that. The spore is universal in nature, but it can able to elicit the infection only in immunocompromised patients, which means whose immune system is very weak, right? Not all the people. It won't touch everyone, right? It specifically target on the people who is experiencing immunocompromised status, right? Immunocompromised status, right? And another thing, the spores are present even in healthy people during the time of laboratory diagnosis. The sputum may contain the spores of this Mucor fungi. So it is everywhere. The spore is everywhere. It is even present in the mucus of healthy human beings, but it can elicit the immunological reactions or immunological diseased conditions only in people who is in immunocompromised state, right? How this fungi gain access into the body? See, there are two proper route of infection, right? How this particular fungus enter into the body. This is what the thing we have to understand. One thing is the fungus enter into the body through the open wound. If we have any bruises or abrasions or open wounds through which the spores present in the air directly gain access into the soft tissues of the human body. So this is one route of entry. Another route of entry is through inhalation process, right? One is through open wound, another one is through inhalation. So these probable routes through which the deadly fungus gain access into the human beings. Okay, so regarding the mycology, right, regarding this fungus, the microscopic observation clearly reveals an important factor that the mycelium, which means the thread-like structure of the fungus, is very fragile in nature. Means they are easily broken. And they can be easily distinguished from the mycelium of other fungus. And the size of the mycelium is about 5 to 15 microns in diameter. So this is what to be mentioned very carefully. The size of the mycelium is little bit mode, right? It is about 5 to 15 microns in diameter, and when compared to other fungus, the mycelium of Mucor is aseptate, which means here you can see number of cross walls, right? There are cross walls in the mycelium, but there is no such cross wall in the hyphae or the mycelium of Mucor fungi. Hence, it is very, very fragile in nature. And during the time of laboratory diagnosis, the sample suspected to contain this particular fungus is not subjected to a process called grinding, right? If we grind the sample, it becomes completely damaged. So it cannot be visualized through microscope. So usually grinding of the sample is not recommended in case of laboratory diagnosis. And so this is what discussed in the last point. Excessive grinding damage the structure of fungus because of its fragileness, right? Other thing. So regarding its structure, this is what I drawn with the help of tools from the Microsoft PowerPoint. So this is the mycelium, so called the thread-like structure, right? And at the tip of the mycelium, you could see a sac-like structure or a bag-like structure, and this is called sporangiophore, right? Sporangiophore. Within the sporangiophore, you could see the number of small red color dots, and these dots are called as spores, right? These spores are actually reproductive structures. So, due to accidental damage caused by any environmental parameters, the spore sac will open, right? The spore sac will open. As a result, spores are liberated in all directions. And these spores are carried by the air, which in turn inhaled by the individual, could result in the progression of the infection. So this is what the simple mycology of this fungus. One is its mycelium is aseptate. Note this point. This is very important. The mycelium is aseptate. Second thing, the fungus has sporangiophore, within which the spores are packed, right? And the third point to be remembered in the case of mucormycosis is when the sporangiophore is broken, the mature spores are liberated into the air, right? They are carried by the air, and when inhaled by an immunocompromised individual, right? In short, I am representing as IC, right? IC means immunocompromised individual. So in those patients or in those people, it is able to grow and reveal the clinical manifestation, right? And regarding the pathogenesis, so when it is inhaled, when the air is inhaled, if the air contain the spores of the fungi, right, through the nasopharynx, it reaches the windpipe called trachea, right? Trachea is called as the windpipe. Fine. So through trachea, it slowly accesses into the deep portion of the respiratory system, right? This is how the spore gain access into the deeper areas of respiratory tract, right? Fine. Finally, it reaches the lungs. So this is how it gain access into the the sporangiophore gain access into the deeper tissue of lungs, right? So after it becomes settled in the lungs, right? So this is the very important stage called the sporangiospores are lodged in the lungs of human beings, right? Just inhalation of the air. Already the air contains the mature spores. I told you these spores are reproductive structures. Whenever it find a suitable substratum, it started to grow. So this is what happened in human beings. When it settled on the soft tissues, it started to grow, right? It started to establish its colonies, right? It becomes access to the distal alveolar space, distal alveolar space, and these red dots are spores, just for your understanding. These are spores, and these blue spheres are alveoli, right? So within the distal alveolar space, the spores started to lodge, they started to settle. So after it becomes settled in the alveolar distal space, since whatever the foreign substance enters into the body, our immune system, right, will start to take war against it. So in this case, the mononuclear cells and polymorphonuclear cells are recruited towards the site of infection, right? So what is infection? Any initial damage caused by a foreign material to the tissue of human beings. If infection is untreated, or if the infection is not properly treated, it leads to disease. So in this case, after the spores are lodged in the alveolar distal space, it recruits two other cell types. One is called mononuclear cells, another one is called polymorphonuclear cells towards the site of infection. So these are MN cells and these are PMN cells, right? Just for a easy understanding, I am representing it. And these mononuclear cells and polymorphonuclear cells are recruited towards the site of infection. Fine. And in the next case, you all know that the blood is red color because of the presence of hemoglobin. Another important cofactor in the hemoglobin is called iron, right? A non-proteinaceous part of the blood is called iron, which is the most important growth factor for the establishment of the spores of the fungi, right? So in this way, this spores, the spores of Mucor fungus started to grow and establish with the help of iron present in the hemoglobin of blood, right? It started to invade, right? It started to invade into the blood vessels, right? And it started to spread through the vessels into the neighboring tissues, right? This is this is how the disease progress within the human body, right? After settling in the lungs, through the blood vessels, it started to spread into the neighboring tissues, right? And the growth pattern is actually invasive because it invade into the blood vessels and spread into the neighboring tissues. Next one, the pattern of growth is called angio-invasive, which means it could able to invade the blood vessels. This is called angio-invasive. Following invasiveness, it reaches the neighboring tissue in a short span of time. Fine. Then what are the symptoms of mucormycosis? And actually, in case of mild skin mucor infection, following are the symptoms like tenderness, blackened skin tissue, fever, blisters, redness, ulcers, and even swelling. And actually, this is not deadly. The one called mild skin mucor infection is not seems to be deadly. These are the following symptoms associated with it. And the next one is called, this is very critical in nature, right? This kind of infection is very critical because the infectious agent, which is the spore of the Mucor fungus, enters into the human body through the process of inhalation, which means they directly settle in the respiratory tract, right? Following are the symptoms like fever, cough, nasal congestion, sinus pain, and headache. So there are two types of mucormycosis. One which gain access into the human body through open wound. Second one, the infection that gain access into the body through the inhalation process. So among the two, the second one is more critical, right? So who are all prone to mucormycosis? Another important question. The patients who are all in the state of organ transplantation, stem cell transplantation, neutropenia, reduced number of neutrophils, long-term steroid uses, right? Prolonged usage of steroid could also lead to the disease called mucormycosis, cancer, skin injury, diabetes, right? Too much iron in the body, the case is called hemochromatosis, right? If a patient is characterized with high content of iron in the body, he or she may also be subjected to the disease, and prematurity and low birth weight, right? And among these different conditions, the people who are experiencing or the people who are all using or who are all taking long-term steroids are also prone to the infection, right? Why the people who are all receiving organ transplantation are vulnerable to this infection? Because prior to transplantation, organ transplantation, the recipient is given with high load of immunocompromised drugs. Immunocompromised drugs. So what is the role of this drug in the recipient? It suppresses the immune system, which means it won't allow the immune system to react. So under this clinical condition, the recipient body is very weak, the immune system is in switched off condition, so that this particular spore gain easily access into the human body and reach the deeper tissues or deeper pivotal organs, right? So you should understand everything. So what are the possible drugs against the mucormycosis? One is amphotericin B, second one is posaconazole, the third one is isavuconazole. So these three drugs are recommended for the infection. But a small difference, amphotericin B and the posaconazole are given IV route, intravenous route, and the third one, right, isavuconazole is the drug given through oral route, right? But the treatment procedure is very costly. A vial of the drug is cost around 9,000 rupees, 9,000 rupees, right? This is not affordable to everyone. This is literally a costly medicine for mucormycosis treatment. So one thing what we can do for escape from this infection is take utmost care and protect your respiratory tract, wear mask, right? And avoid going to places like the place which is rich in compost and place in which new buildings constructions are going on, right? These things are attracting, right, or these things are prone to contracting the infection towards a healthy individual, right? So thank you for watching this video lesson, and I'm sure you will enjoy the complete session. If you have any queries, post your queries to the mail ID given in the presentation, and keep in touch with me through this mobile number given in the presentation. Thank you. Thanks for watching. I'm sure we will meet in another video session. Bye-bye.